My name is Rachel Monroe, and for 16 years I worked as a cardiac ICU nurse at St. Helena Memorial Hospital, a regional medical center tucked into the gray sprawl of western Pennsylvania. I wasn't supposed to be on call in the ER that night. ICU nurses don't usually get dragged downstairs unless every other line of defense has fallen. But one of the emergency charge nurses had been injured in a car accident earlier that week, and administration decided to fill the hole with whoever was willing. Against my better judgment, I said yes. That's how I found myself wearing two hats: ICU specialist and ER backup, a role I'd never trained for but couldn't refuse. The date was October 19th, the air outside still carrying the damp bite of autumn, and the hour was 2:14 a.m. when my pager lit up with the call that would unravel everything I thought I knew about death and return. When you've worked night shifts long enough, your body learns to live in fragments. You sleep in fits, eat at strange hours, and listen for alarms even in silence. That night, I'd been in the ICU finishing a chart, the fluorescent hum above me the only company. When the page came through, code to ER, cardiac arrhythmia, unstable. Normally, that would have been the domain of the ER nurses with cardiology backup, but they needed me specifically. Someone who could handle the full brutality of a heart turning against itself. I remember glancing at the clock. 2:14 a.m. a time that would etch itself into me like a scar. The walk from ICU to ER is short, 2 hallways and 1 elevator, but it felt longer that night. Each step carried a weight I couldn't name. The hospital had that strange quiet that comes when even machines seem to be holding their breath. As the elevator doors opened into the ER, I caught the sound before I saw the patient. The staccato shriek of a monitor in distress. The uneven chorus of voices trying to wrestle chaos into order. The patient was a man in his late 60s, stocky build, salt and pepper hair damp with sweat. He had come in earlier with what should have been a straightforward post-op complication. A vascular repair, stable recovery, routine discharge, planned for later in the week. I had even passed by his chart during earlier rounds and thought nothing of it. But now, here he was, strapped to a gurney in Trauma Bay 3, his skin pale as parchment and his chest heaving like every breath was borrowed. His rhythm was sliding in and out of coherence, PVCs spiking like static across the screen, blood pressure skidding lower each minute. "Rachel, thank God," one of the ER nurses said, relief mixing with panic in her voice. "We've tried stabilizing, but he keeps slipping." She didn't finish, because in that moment his rhythm lurched into something darker, ventricular tachycardia. Numbers climbing a ladder to nowhere. I felt the floor of the room tilt. Everything that had been theoretical seconds before was now absolute. There's a strange stillness that lives in the eye of an emergency, a clarity that only comes when every second could split into survival or loss. My hands moved on their own, ordering meds, checking IV access, preparing for the shock we both hoped would not be necessary. He looked at me then, eyes wide, voice ragged but unmistakably human. "Something's wrong. I can't breathe." The words clawed at me because I could see it in his chest. The heart's desperate stutter, the lungs trying to keep up with a rhythm that no longer believed in balance. We shocked him. Once. Twice. The first jolt brought him back, the second held him, if only for minutes. His heart stumbled, then tried to walk again. I leaned close, told him he was safe, even though my own heart knew safety was the one thing I couldn't promise. For a brief window, the monitors softened, the lines straightened, and the room remembered how to exhale. He even managed to whisper something about wanting to see his wife in the morning, about how he had promised her this would all be over soon. I held on to that, because sometimes hope is the only medicine we have. But the body is a trickster. It waits until you begin to believe, and then it snatches belief away. At 2:37 a.m., less than a quarter hour after my pager had dragged me downstairs, his rhythm collapsed completely. Flatline. The room surged into code blue protocol, and I moved with the practiced rhythm of 1,000 drills, compressions, meds, shocks, airways. Time blurred. Minutes became both endless and non-existent. I remember sweat dripping down my back, the feel of ribs yielding under my palms, the look in the residents' eyes when they realized their textbooks hadn't prepared them for this. 40 minutes we worked. 40 minutes of trying to pull him back across a line that grows sharper the longer you fight it. Finally, the attending gave the nod. Time of death was called. I stood there, chest heaving, gloves sticky with adrenaline and failure, and felt the cruel weight of the moment press down. He was gone. I told myself it was over. I was wrong. That was the night, at St. Helena Memorial, that I learned 2:14 a.m. can mark not just the moment a life begins to end, but the moment the rules of life and death decide to bend in ways we cannot explain. I stayed in the room longer than I should have after the attending pronounced the time of death. It was 2:57 a.m., and the overhead lights felt harsher than usual, as though they wanted to burn away every trace of what had just happened. The residents filed out first, whispering to each other, already dissecting the case like a puzzle they might solve on paper later. The ER charge nurse clapped me on the shoulder in that quiet, exhausted way we do, when words would break us more than help. And then it was just me, the body, and the ritual of closure that every nurse knows by heart. I turned off the drips, disconnected the IV lines, removed the monitor leads one by one. Each click felt final, like shutting down chapters of a book you never wanted to finish. I straightened his blanket, smoothed his hair back. These small gestures matter to me, tiny attempts at dignity in a place where dignity is too often stripped away. The monitor screen went dark. Silence settled in, broken only by the soft hiss of the air vent and the scratch of my pen as I began filling out the forms that turn a human life into lines of data. Name, age, time of death, cause. The coldest language for the warmest loss. At 3:09 a.m., 12 minutes after the attending had called it, I heard something that should have been impossible. A sharp, steady beep, rising from the silence like a voice you thought you'd never hear again. For a moment, I froze, my pen suspended over the paper. It was coming from the central monitoring station, just outside Trauma Bay 3. I told myself it had to be an error, a crossed lead, a leftover signal from another room. I had removed his wires myself. I had watched the screen go blank. There was no way. But when I stepped back into the bay, the monitor by his bedside had lit up again. A perfect sinus rhythm, heart rate 72, blood pressure scrolling across the screen as if nothing had ever happened. My own pulse hammered so loud in my ears, I could barely hear the machine. The sheet over his body was still drawn to his chin, his chest still. And yet the monitor insisted he was alive. I moved closer, every step heavier than the last. My fingers trembled as I reached for his neck, pressing into the familiar groove of the carotid artery, prepared to feel nothing but silence. Instead, I felt it. A pulse, strong and steady, as undeniable as my own. My breath caught in my throat. His chest rose, shallow but real. I pulled the sheet back, and his eyes fluttered open. He looked at me, confused, as though waking from a long, strange dream. His voice was weak but steady. Where am I? I couldn't answer at first. My mouth opened, but no words came out. Because what words exist for a man who was gone, whose death you had written into a chart, now staring at you as if none of it had happened? The door banged open behind me. One of the residents had returned for his stethoscope. He stopped dead in the doorway, eyes wide, color draining from his face. Rachel, what the hell? What the hell indeed. I didn't have an answer for him. All I knew was that a man we had worked on for 40 minutes, who had been cold and still and declared dead by every standard of medicine, was now breathing, speaking, alive. The resident's stammer had barely left his mouth when I bolted into the hall, shouting for the attending to come back. My voice cracked, half from exhaustion, half from disbelief, but it was enough to summon everyone who had just walked away. Within a minute, the trauma bay was full again. Doctors, nurses, respiratory, even the night supervisor who usually only appeared for paperwork or family updates. The attending looked furious at first, as if I had lost my mind, until he pressed his own fingers to the man's neck and felt what I had felt. His brows knit, then lifted, then collapsed into a scowl of confusion. "This isn't possible," he whispered, though the monitor sang its steady truth right behind him. Suddenly, the room was alive in a different way, buzzing not with panic, but with disbelief. Orders flew: blood work, arterial blood gases, a 12-lead EKG, portable chest X-ray. I moved through it all in a daze, drawing tubes of blood from the same IV line I had already flushed as part of post-mortem prep, my gloved hands trembling. The lab labels felt heavier than usual, as if I were sealing proof of something the world wasn't ready to believe. The tests came back one by one, and every result contradicted the last 2 hours of horror. No cardiac enzymes to suggest tissue death. Normal electrolytes. Blood gases within range. The EKG printed out a perfect sinus rhythm, almost arrogant in its simplicity. It was as though his heart had been rebooted to factory settings. By then, he was sitting up against the raised head of the gurney, eyes wide and scanning the room like a man trying to measure whether the nightmare was still going. He wasn't weak or groggy the way post-code survivors usually are. He looked bewildered but not broken. When the attending asked him how he felt, he said something that chilled the entire room. "I feel fine. Better than before. But I saw you. I saw all of you. I was watching from above." The silence that followed was worse than the code itself. Nurses stopped mid-motion. The resident who had first witnessed him alive again backed into the corner, clutching his stethoscope like a talisman. The patient's voice was calm, almost casual, but his words twisted the air into something electric. He described watching us compress his chest, seeing the shocks, the medications pushed into his line. He even described the attending's left shoe coming untied during compressions, a detail so absurdly human that I felt goosebumps rise on my arms. Then his tone shifted. "There was a light," he said softly, almost apologetically. "Not like a bulb, more like warmth you could see. I was moving toward it, but then I heard someone call my name. It was my wife, clear as if she was in the room. She told me not to leave her. And then I was back." A murmur rippled through the staff. Some shook their heads. Others exchanged knowing looks, but no one dared call it nonsense outright. We'd all been there when he was cold, when his pupils were fixed, when rigor mortis had already begun to whisper its arrival. And yet here he was, pulse steady under my fingertips, recounting a moment no textbook could ever prepare us for. I found myself staring at the clock again. 3:26 a.m. Barely half an hour had passed since we called him gone, and already he was unraveling the border between life and death with his simple, steady words. By sunrise, the hospital grapevine had already carried the story into every wing. The night shift had handed it off to the morning crews like a rumor too heavy to hold, and by 8 a.m., administrators were trickling into the ER one by one, trying not to look like gawkers but failing. I watched as specialists filed in, cardiologists, neurologists, even a visiting professor from the university downtown, who had been called just to observe. They gathered around the man's bed like pilgrims at a shrine, reviewing printouts, repeating exams, whispering theories that grew thinner the more they spoke them out loud. Every scan, every lab, every test came back not just normal but pristine. It was as though he hadn't coded at all, as if the night had been a bad dream only we remembered. For the others, this was a case study. For me, it was a crack. Not just a crack in medicine, but in the walls I had built between science and belief. I had spent my career speaking the language of numbers. Milliliters, milligrams, joules, beats per minute. Numbers were safe. They explained suffering without drowning you in it. But now here was a man who had crossed over those numbers, who had stopped being a body and then returned as if pulled back by something stronger than medicine. The residents debated hypokalemia, delayed drug action, spontaneous defibrillation. The neurologist suggested a misinterpretation of rigor, that maybe I had seen stiffness from catecholamine flood instead of true death. Their voices droned on like static, trying to patch a hole with tape. Meanwhile, his words haunted me. "I saw you working on me. I heard my wife." He didn't speak of pain or fear. He spoke of light, of warmth, of a call that reached across whatever threshold he had been standing on. And that's where the real crack split open inside me, the space between medicine and meaning. I'd been raised to think of heaven and hell as stories to comfort children, or frighten them into obedience. My profession trained me to believe only in what I could touch, chart, measure. But standing there, remembering the way his chest had been still, the way his pupils had failed to respond, the sheet already drawn up over him, I felt the terrible possibility that we were wrong about more than just the body. I started hearing my own conscience ask questions I wasn't ready to answer. If his wife's voice pulled him back, was that love strong enough to reach through death? If the light he saw was real, then what had I been telling myself all these years about nothingness? And darker still, if there is a place beyond, then there must be two places. What about the patients I couldn't save? The ones who slipped away under my hands? Where had they gone? Had my words of comfort been lies? Or had I unknowingly ushered them toward something they feared? By mid-afternoon, the ER felt less like a hospital and more like a courtroom where belief itself was on trial. The specialists leaned on science. The family whispered words like miracle. And I stood in the middle, my heart pulled both ways until it felt like a rope ready to snap. Every beep of the monitor mocked me, because it said what I couldn't, that life and death weren't as absolute as we wanted them to be. I walked out into the corridor, leaned against the cool plaster wall, and closed my eyes. Behind them, I saw flashes of every code I'd ever run, every patient I'd ever pronounced, every family I'd ever told, "I'm sorry." There was nothing more we could do. And for the first time in my career, I wondered if I had been wrong, not just medically, but spiritually. If medicine is the science of the body, what do we call the science of the soul? That question wouldn't let me go, not then, not in the days that followed, not even now. I didn't last much longer in the ICU after that night. On paper, I kept working, rounds, med passes, family updates. But inside, I was unraveling. Every code after him felt different. Every time the monitor flattened into silence, I froze, waiting for it to start singing again. I stared at bodies longer than policy allowed, fingers pressed against cold skin, terrified of walking away too soon. I told myself it was caution. But the truth was, I had lost faith, not just in medicine, but in the finality of death itself. The cracks widened in places I didn't expect. Walking past the hospital chapel, I'd find myself lingering at the door, though I hadn't prayed since childhood. Listening to families cry, I'd hear echoes of his words about light and warmth. And worse, when a patient slipped away and didn't come back, I couldn't shake the thought that maybe they had gone somewhere else. Somewhere I couldn't reach, somewhere not all light. I began to picture them standing on the edge of something vast, being pulled one way or another. Heaven, hell. Two words I had trained myself never to use, suddenly impossible to ignore. Good and evil had always been abstract to me, concepts for theologians, not nurses. But now, watching the fragile boundary between life and death tear open, I wondered if every code was more than medicine. If each one was a battle fought in two places, on the bed where our hands pressed against chests, and in some unseen realm where love and fear and judgment wrestled for the soul. What if every time I whispered, "Stay with us," something darker was whispering too? The questions poisoned my focus. I became jumpy, distracted, hesitant, at moments when certainty saves lives. And so, 3 weeks after that night, I handed in my resignation. I told the director I was pursuing outpatient work, where the stakes were lower, where death didn't sit in every corner. That was the official story. The real one was simpler. I could no longer walk into those rooms pretending I believed what I once had. The man lived. He walked out of St. Helena Memorial days later, hand in hand with his wife, thanking us as though we had done something more than stand dumbfounded at the threshold of a miracle. He gave interviews, told his story at conferences, became a symbol of resilience. I should have felt pride. Instead, I felt only the weight of everything unanswered. And here I am, years later, still haunted by that 2:14 a.m. call. Haunted not by the sight of his body under a sheet, but by the sight of him sitting up afterward, breathing as though death had been a detour instead of a destination. Haunted by the thought that medicine had reached its limit and something else, something nameless, had stepped in. What I know is this. I've seen a man return from where none of us should return. I've heard him describe a light I can't explain, and a voice that pulled him back from it. I've seen the rules of biology collapse in the quiet hours of the night, and ever since, I've lived with the suspicion that what waits beyond us is not silence, but choice. Choice between light and shadow, between mercy and despair, between heaven and something darker. I walked away from ICU nursing because I couldn't pretend anymore that I only worked with bodies. That night taught me I was also brushing against souls, and I wasn't brave enough to carry that burden. But even now, every time I hear a monitor beep, I remember him. And I wonder about the hundreds I've pronounced gone, and whether some of them were still listening, still watching, still waiting to see if love would call them back, or if something else would claim them instead. Tell me, what do you believe happened that night? Was it science we don't yet understand? Or was it proof that life and death are not ours to decide?